What if I told you that the medication keeping someone's mental illness under control could also quietly be giving them diabetes? Or that the same drug that finally stabilized someone's mood could add 30 pounds to their frame, and nobody warned them that it was coming? And what if there were newer medications, one you've definitely heard about, that might actually fix both problems at the same time? Stick with me, because today we're going somewhere that most psychiatrists aren't talking about yet. Hi everyone, welcome back. Or if you're new here, welcome. I'm Dr. Dona, a youth and adult psychiatrist and obesity medicine physician, here to discuss all things mental health and wellness related. And today's topic is honestly one of the closest things to my heart, because it sits right at the intersection of everything I do every single day in my clinic. We're talking about psychiatric medications and metabolic syndrome, what that actually means for patients and why it doesn't get talked about enough, and specifically how GLP-1 medications like Ozempic or Wegovy might actually play a role in helping. Now, if you caught my last video on GLP-1s and mental health, you know I'm kind of obsessed about this space. But today we're gonna go even deeper because I genuinely believe patients deserve the full picture. So let's get into it. Okay, so here's something I want you to really sit with. People with serious mental illness, we're talking about schizophrenia, bipolar disorder, major depression, they die on average 10 to 20 years earlier than the general population. And a huge chunk of that is not from suicide or accidents. It's from cardiovascular disease, from diabetes, from metabolic syndrome. And a big reason for that, the very medications we use to treat their psychiatric conditions. Now, I want to be very clear here. I'm not anti-medication. I prescribe these medications every single day and they save lives. But we have to be honest about the full picture because glossing over the side effects doesn't serve our patients. So what is metabolic syndrome? It's basically a cluster of conditions that together skyrocket your risk of heart disease and diabetes. We're talking about high blood pressure, high blood sugar, excess belly fat, abnormal cholesterol or triglycerides. You need 3 of those 5 criteria to be diagnosed. And unfortunately, many of my patients on certain psychiatric medications check several of those boxes. So, which medications are we talking about? Let's get into the specifics. The biggest culprits that I'm talking about are atypical antipsychotics. There are medications like olanzapine or Zyprexa. This is probably the worst offender. Patients can gain 20, 30, even 40 pounds. I've seen it. Quetiapine, also known as Seroquel, clozapine, which is extremely effective for treatment-resistant schizophrenia, but metabolically it's a challenge. Risperidone and aripiprazole are a bit better, but they're not off the hook. Some mood stabilizers like valproate, which is Depakote, can also cause significant weight gain. And even some antidepressants, particularly mirtazapine, Paxil, can pack on the pounds. Now, why does this happen? It's not because patients are lazy or not trying. These medications affect receptors in the brain, histamine receptors, serotonin receptors, dopamine receptors that regulate appetite, metabolism, and how your body stores fat. The biology is literally working against them. And here's the really heartbreaking part. Weight gain is one of the top reasons patients stop taking their psychiatric medications. So they're faced with the impossible choice, mental health or physical health. And no one should have to choose. And I want to flip it around for a second because the relationship goes both ways. Metabolic dysfunction doesn't just affect your body, it affects your brain. Insulin resistance, for example, is increasingly being linked to depression and cognitive changes. There's a reason some researchers are starting to call Alzheimer's disease type 3 diabetes. Inflammation from metabolic syndrome crosses the blood-brain barrier and can worsen psychiatric symptoms. So you've got this vicious cycle. Psychiatric illness leads to medication, medication leads to metabolic changes, and metabolic changes then worsen inflammation and brain function, which makes the psychiatric illness harder to treat. That cycle needs to be broken, and that's where things get really interesting. Okay, so you know I love talking about GLP-1 receptor agonists, medications like semaglutide, that's Ozempic, Wegovy, and tirzepatide, which is Mounjaro or Zepbound. These medications were originally developed for type 2 diabetes, but they've become this incredible tool in metabolic medicine. They work by mimicking a hormone in your gut naturally releases after eating, which is a GLP-1, which signals to your pancreas, your liver, and especially to your brain that you've eaten and that you're satisfied. They lower blood pressure, they lower blood sugar, improve cholesterol, and cause significant weight loss. They address almost every component of metabolic syndrome. But here's what makes this especially exciting for my patients. There's emerging research that GLP-1s may specifically help with antipsychotic-induced weight gain. There have been small studies and some smaller trials now being conducted looking at whether adding a GLP-1 to someone's regimen while they're on olanzapine or clozapine can counteract the metabolic side effects without taking away the psychiatric benefit. Early results are really promising. And beyond the weight piece, GLP-1 receptors exist in the brain too. They play a role in the dopamine reward pathway, in the hypothalamus, in areas that regulate mood, motivation, and even addiction. This is probably why we've been hearing anecdotal reports on people on Ozempic having reduced cravings, not just for food, but for alcohol, nicotine, and even compulsive behaviors. Now, I want to be careful here. We don't have all the answers yet. This is an area of active research. But as a psychiatrist who is also trained in obesity medicine, I find this incredibly exciting. So what does this actually look like in my clinic? When I start a patient on an antipsychotic, I now have a conversation from day one about metabolic health. I get baseline labs, fasting glucose, HbA1c, lipid panel, weight, waist circumference, because you can't treat what you don't measure. And honestly, a lot of psychiatrists don't do this consistently. We get so focused on the psychiatric symptoms, which is understandable, that the metabolic monitoring gets missed. I'm saying that as someone who is very aware of this gap in our field. If I'm prescribing a high-risk metabolic medication like olanzapine or clozapine, I'm also thinking, does the patient have other risk factors? Do they have family history of diabetes? Are they already overweight? And what can we do proactively? This might mean lifestyle counseling. It might mean choosing a metabolically friendlier medication when clinically appropriate. And in some cases, and this is a newer thinking, it might mean considering a GLP-1 concurrently to protect their metabolic health while we treat their mental health. This is a conversation worth having with your psychiatrist. And if your psychiatrist isn't bringing it up, it's also okay to ask. Also, something psychiatrists have been doing for some time is considering a metformin in addition to these medications. Okay, I want to wrap up with something I say to my patients a lot. Mental health and physical health are not separate. They never were. Your brain lives in your body, and what happens to one affects the other. When we treat psychiatric conditions, we have to be thinking about the whole person, not just the symptoms. If you're on a psychiatric medication and you're concerned about weight gain, metabolic changes, or you just haven't had this conversation with your doctor, please bring it up. You deserve that level of care. And if you're a provider watching this, let's do better at monitoring our patients metabolically. It doesn't have to be complicated. It just starts with asking the question. I'll link some resources below if you want to read more about metabolic syndrome, antipsychotics, and the GLP-1 research. And if you have any questions, drop them in the comments. I'll read them and I do my best to respond. If this video was helpful, please share it with someone who might need it. And don't forget to subscribe. We're building a community here that takes mental health seriously in every sense of the word. All right, I'll see you in the next one. Take care of yourselves. And make sure to check out other videos on GLP-1s. This is Dr. Dona.